Next, we'll hear from Productive Practices, and our presenter will be Dr. Carlos Sanchez.
We don't see in nature straight lines. Teeth have contour, shape, and form. They don't come in large, medium, or small sizes. So I pose this question: why are we using flat instruments, straight instruments for your composite restorations? Good morning, my name is Carlos Sanchez. I'm a general dentist and a developer of the CASI instrument. This simple, multifunctional, composite interior sculpting instrument simplifies your restorative work. It comes in two sizes. It comes in large and small. Your large is primarily for your centrals, your canines, and the smaller instrument works well for your laterals and lower teeth. Now, what makes this instrument unique and special than any other instrument in the market right now is the curvature, the taper, the thickness, and the sharpness. And what this allows you to do is to get unprecedented access to areas that are hard to get to. So let's take a look here at the overall view of the instrument. And as we can see here, we have the broad surface that works fantastic on the facial surfaces here. We're looking here from the labial and lingual aspect of it. Here's the curvature. And the tail end of the instrument serves well for the proximal areas, for those line angles, subgingivally as well. Here. Now with this feature, what this instrument is going to allow you to do is have versatility, and that's what we want in our regular routine practices with composite restoration. We want to get in and get out. So here, let's look at some couple cases. Let's look, just concentrate on what the instrument was able to provide. This individual is missing tooth 25. Now, with other ends of the instrument, we're able to contour the facial anatomy, the primary anatomy, the global anatomy, and this is where the instrument really shines. If you want to start developing that curvature, this instrument works fantastic to create that arch curvature that is so essential. And the time you save with this is unprecedented. And here, as we look at it, because of the curvature, we have access to the lingual surfaces. And here's the finished product. Class 5, boring, right? It's going to be a piece of cake with this thing. Save you time in half. And this is, now check this out in action. This is awesome right here. So here we're working, we're tacking the composite down, right? Doesn't matter which side you use. There's not a wrong or right way of using the instrument. And what we're going to do here is follow it up by removing the excess. You remember those distal part line angles? That's hard to get. Look what we're doing here. Coming in, removing the excess. Now we're going to do the gingival roll. This is the best part right here. Check this out. Look at that. You tell me an instrument that can do that. A flat instrument. Mm-mm. Look at that. Ooh, pretty. And here what we have is, this illustrates the fact, because of the character of the instrument, the access that you have, the ability to have access. Again, this one is the finish. If you notice the blue parts, those little rubber tips, that means what I did here was basically to show we literally light cured it, went out, got my cup of coffee, my lovely assistants went ahead and finished the restoration for me, polished it. Here's an emergency case. How do we use the instrument? Simple, we create the lateral walls with it, come back on the labial, Maillard pull technique, facial veneer, and you're done. Here we go. How about class 3? Boy, having that excess in the lingual surface, that takes time. I mean, that takes some time. Well, you use the instrument for support, and the lingual surface is created for you. So here we place the Maillard, behind it the casting instrument, like curate. There's the first layer, and come in from the facial side. So again, the instrument, because of the contour, it just facilitates finishing, and it's the instrument a lot more. You can be more efficient. Now, class 4. Here's another. This is slam dunk with the class 4. You follow your bonding procedure, place the first layer. And here, utilize what the tooth has to offer. And because of the contour, then what it does, all you do left and right, forward, and you have that 3D shape that we're always looking for. And here's the finished restoration. The last case here now, when you come in like case, and you may say, why this young lady needs some bonding? Well, she wanted to add some volume. And also in this case, you can't solve this with ortho. So what we did is we add all additive, no anesthetic. We used the casting instrument, using the template, and we were able to facilitate the contour, the 3D that we need on a tooth. And here's the finish. This was 2 hours, before and after, and a happy patient. What this instrument does is up to your imagination. I have a brother who's a dentist. He says, we better mention this to everyone. But he uses it for packing cord, and it's true. You get the thin biotype, and it's hard to get them. So that's one aspect of it. When you're doing, for example, a subgingival, and you have a lot of hemorrhaging, you can use the instrument to retract the tissue and continue with your procedure. So what I leave with this instrument is multifunctional, it's simple and efficient. It's going to make your composite restoration efficient. It's going to save time and lots of headaches. In Optimus, here we go, we're done. Oops, sorry. I will be in booth 515. I welcome everyone there. Have any questions? We do have some brushes there. I like to give them away also too. And I hope you guys does anyone have any questions? I know I went I only have 10 minutes, but please ask a question. No questions. Yes, I got a question. 515, productive practices. Yes, ma'am. Come on, give me a clinical. There's two. And with those two, you can literally, with your armamentarium, cut it in half. All you're gonna need is your Mirror Explorer and these two instruments. And a brush. And the brush. Okay. That's it. Anybody? One more question? How much? I was hoping to be asking that. They retail, each one of them is for $69. Okay? Now, what you have to understand about this instrument, it is patent designed. It's the only one you can't find this instrument. You're going to have to wait 10 years for it. I hope everybody enjoys the meeting. And without any further ado, I'm done.